Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is, how do you stop an excess of vaginal secretion when you're not sexually active? Let me start by saying that vaginal secretions are normal even when not sexually active. The secretions that come out of the vagina come from a few places. They come from your vagina, but they also come from your cervix and your uterus. And these secretions are actually really important for your vaginal health. And I'll talk about when you should be worried about them in a minute. But first, since as a culture we very rarely talk about female anatomy and what's normal and what's not, it's easy to be concerned if you're having daily vaginal secretions. So let me make sure I say this again. Vaginal secretions are normal and important for vaginal health. Vaginal secretions can vary based off where you are in your menstrual cycle, assuming that you're still getting one. Often there's going to be a range in the amount from day to day or week to week. There's also going to be a change in the texture. As women get closer to ovulation, the cervical mucus will feel slippery. Monitoring your cervical mucus is actually a form of natural family planning. The thing to keep in mind here is that it's important that you get to know your body and what the range of normal is for you. Now, if you start to see secretions that are different and not normal for you, then it may be time to take some action. These differences may be in terms of color or smell or texture. Vaginal secretion should normally be either a clear or a slightly off-white color. If there's suddenly a different color than what you're used to seeing, I would say go to a healthcare provider. Same thing if there's a smell that's not normal for you, or if the texture is clumpy. If you're feeling pain or itchiness in or around the vagina, definitely go see a healthcare provider. Those can be signs of an infection. I kind of want to say something here like you shouldn't want to stop an excess of vaginal secretion. It's totally normal. But I also don't want to dismiss the fact that you are bothered by this enough that you submitted the question. So if the vaginal secretion isn't abnormal for you, but you're bothered by it, I would ask yourself why you're so bothered by it. One of the purposes of vaginal secretions is to lubricate the vagina when you're sexually excited. And I know some people don't like feeling aroused when they're either not sexually active or don't have a partner. If this is the case, remember, it's perfectly normal. And there's really not much you can do about it, except maybe try to be less aroused, but that doesn't really sound like a lot of fun. If I completely missed the mark on this one, or if there's more that you need to let me know, please submit a follow-up question. Until next time, be safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Twitter. And make sure to check the description for links where you can submit your sex question.